Now recall the core principles of naturopathic medicine, principles that are largely shared by acupuncturists and Oriental medicine practitioners, nutritional and exercise specialists, herbalists, behavioral psychologists, and others that are trained at this university. Do you know these principles? Number one? That's not number one. Come on. Yes, right. Let nature heal, right? Find and foster this, the vital force of healing. Number two? Identify and treat the causes. Exactly. The four core domains of chronic illness: social, psychological, physical, and environmental. Number three? You jumped the gun a little bit before. What's number three? First, do no harm. Exactly. Use low-risk, non-suppressive, individualized approaches. Number four? What? Educate patients. Work closely with them in attaining health. Number five? Very good. Treat the whole person. In fact, both groups even spell it with a W. Isn't that remarkable? Number six? Prevent illness and create wellness. There isn't a number seven. Now, number seven in the medical home is payment for appropriate added services. What's the deal here, huh? There's no payment, and there's no evidence-based medicine, and there's no quality improvement in the core principles. Might that be a problem for effective integration into our current healthcare system? What I find remarkable is that many of the core principles of these professions overlap directly. Whole person care, patient-centeredness, safety, patient involvement in care, integrated care. It's also notable to see the differences: the use of nature, the role of prevention in healing, the meaning of patient education is interpreted differently, the use of evidence, technology, and quality improvement, and the issue of payment. Any type of integration of these professions into teams of care must attend to both the common goals and address the differences. I emphasize integration because team models of whole-person care will need to emerge if healthcare reform is really going to achieve its primary goals. Recently, a coalition of insurers, physicians, pharmaceutical companies, and others who are at the heart of our biomedical system have vowed to cut costs and improve quality. Now, while the quality issues were a bit vague, the cost cutting is said to be the equivalent of 1.5% reduction in the growth rate of healthcare over the next 10 years. Now, increased efficiency in the system management of healthcare has been tried before. I'll leave it to you to decide whether you think a reduction in the margin of cost increase, a slightly flatter rise in the slope, is a signal of transformation, a paradigm shift, or if it will produce the two core elements we've discussed: health and care. The irony is that we already know what the pillars of human flourishing are. We already have good science and good evidence that tells us what those are. There's social integration, stress management, exercise and rest, and appropriate exposure to a clean environment. And that includes no smoking, no to moderate alcohol intake, and not being exposed to toxic chemicals or a poor diet. We know that these four pillars, the social, the psychological, the physical, and the environmental factors, contribute up to 70% of the chronic diseases that we suffer from today. Thus, they form the foundation of both prevention of chronic disease and management of disease once disease is developed. If the healthcare reformers are really looking to get the best bang for their buck, both in the prevention and management of chronic disease, they need look no further than delivering these four pillars. Of course, the key to effective healthcare delivery is in the term delivery. You've got to be able to get it out there. To bring healing back into healthcare, we must have a system that provides the tools and the practices necessary to make healing happen. in the common context of everyday life. Right now, it does not do this effectively. If you look at the top 5 health-producing behaviors, the simple ones, no smoking, adequate exercise, a healthy diet, stress management, and early disease detection, only 2 to 4% of the population engages in all 5. 4% of women. They double what men do in those areas. The issue is not about science. The issue is not about the facts that we need in order to reduce costs and improve health. We already know those. The issue is about delivery. We need a system, a culture, and an industry that can create healing, that has salutogenesis as its primary focus, and has wellness as its primary goal. We need a wellness initiative for the nation. As in all such cultural change movements, leadership is crucial. We'll need the innovators that reach out, grab the concepts in the dust cloud, and pull them into the center. We'll need the advocates, the ones who are passionate enough about the creation of healthcare to make it a part of daily practice, personally and professionally. We will need the avatars, the information systems that incorporate what we already know about health creation into a format and a process that allows us to deliver it to every person. We will need an industry producing the tools and the technologies for a wellness system that is as powerful as the vast disease treatment system we currently have. So my question to you, graduates, will you become leaders? Will you be the inspiration for putting healing into healthcare reform? You can do this if you're willing to emerge out of the dust cloud and into the center by creating integrated models of quality and low-cost healing with the mainstream. Your predecessors have fought hard and successfully to maintain the core principles of healing. They've trained professionals in natural health care to which you now hold a degree. Don't lose those principles. They will become the rules. My charge to you, however, is to go beyond the establishment of the professions. Join with others who share the common values of health, healing, wellness, and care. Become the leaders of a true healthcare reform. In your practice, in your research, in your teaching, in your community, and in your local and national governments. The time has come for those who seek to cultivate healing to reemerge from Dr. James's dust cloud of exceptional observations and become the rules of our healthcare system for the 21st century. Good luck, and may the force of healing be with you.